Hi, my name is Jessica, and it's a pleasure to present in this event the study Evidence-Based Practice for Female Urinary Incontinence Treatment according to Brazilian physiotherapist perspective. This research was done by me and PhD students Jordana Silva and Ana Jéssica Sousa, and Professor Patrícia Driusso from Physical Therapy Department at Federal University of São Carlos. This research was financed by São Paulo Research Foundation. We know that evidence-based practice is the integration of physiotherapist clinical experience, scientific research, and patient preferences. Because of this, the aim of this study was to analyze the opinion, knowledge, skill, and barriers related to EBP for female urinary incontinence treatment according to Brazilian physiotherapist perspectives. For this, we carry out an original cross-sectional study from January to March in 2021. Physical therapists who worked in women's health were included. They also had a valid certification emitted by the Brazilian Physical Therapy Registration Board of their region. A self-administered structure questionnaire was applied to assess the participants should answer the questionnaire according to a 5-point Likert scale, where 1 means strongly disagree, 2 disagree, 3 neutral, 4 agree, and 5 strongly agree. Data analysis was performed using SPSS. Categorical variables were expressed as frequencies and percentages, and continuous variables were expressed as mean and standard deviation. As a result, 43 Brazilian physiotherapists were included in the study. The most of the subjects was female and was from the age group of 20 to 29 years old. The average of graduation time was 6.12 years. Only 23.3 and 4.7% of the physiotherapists concluded the master and PhD studies. The most of responded declared to work in private clinics, while a seventh of the subjects declared to work with education research. This table is about the opinion, knowledge, and skills of Brazilian physiotherapists regarding the EBB during urinary incontinence. We can see that most of the Brazilian physiotherapists strongly agree that EBP can assist the making decision about patient care. We also can see that more than a half of the physiotherapists strongly agree that they were instructed to evaluate women with urinary incontinence. Here we can see the barriers reported by participants of this study. Barriers related to EBP often reported by the subjects were the difficulty to understand statistical analysis, and the less frequently cited barrier were lack of interest in research and lack of incentive in research weekly. In short, there was also strong agreement that EBP can assist the making decision about the patient care. More than a half of the physiotherapists included in the present study strongly agree that they were instructed to evaluate. Difficulty in understanding the statistical analysis of scientific research was the most commented barrier. The less frequently cited barriers were lack of interest in research and lack of incentive in research weekly. We conclude that Brazilian physiotherapists are interested to learn or improve skills to apply EBP on urinary incontinence treatment routine, even though they have learned to assess and treat women with urinary incontinence during graduation. However, there are some barriers related to EBP implementation on clinical practice in Brazil. Thanks to International Continence Society for the opportunity to present this study.